Hello, I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection. June is Alzheimer's and Brain Awareness Month. In the United States, more than 6 million individuals are living with Alzheimer's disease. That number is projected to increase to approximately 13 million by the year 2050. The Alzheimer's Association has many services and resources, both for those living with dementia and those caring for someone with dementia. Here today to help us learn more are Makeba Huntington-Symons and Denisse Rodriguez, program managers from the Alzheimer's Association Gulf Coast chapter. Thank you both for being here today.
Thank you, Patricia. Nice to be here.
Makeba, the Alzheimer's Association has programs both for individuals with dementia and caregivers. Is that correct?
Yes, you are absolutely right, Patricia. The Alzheimer's Association provides a number of educational programs that help to better understand the disease, understand Alzheimer's and dementia and other related topics. Education is intended for everyone, from professionals to family caregivers, to professional caregivers, to persons with dementia and the public. And to illustrate some of our programs, for example, we have our Understanding Alzheimer's and Dementia program, which provides a foundational understanding of the disease. We also have our 10 warning signs program. And for those caregivers who are caring for someone with Alzheimer's or other dementia, we have our Effective Communication Strategies program for those individuals. We also have a service that is very useful for caregivers, and that's our care consultations. And they can be performed through the helpline or with the program manager, such as myself or Denisse, and we can help them with individualized support and resources, not only to the caregiver, but to the person who is living with the disease. This is essentially a personalized service for individuals and families that are facing many decisions and challenges associated with dementia. And the overall goal of a care consultation is to better understand the disease and to plan and develop strategies to assist with the diagnosis and related challenges. Now, we have a number of support groups for individuals who are in the early stages of the disease. We also have support groups for the LGBTQ community. We have support groups for individuals who are simply family caregivers, and they want to get together with other caregivers to discuss their journey along the way and to feed off each other and find resources through these support groups. But our early stage social engagement programs offer a way for those who are in the beginning stages of Alzheimer's and other dementia to stay engaged and connected with others, as well as with their caregiver. And these programs have many benefits, as it allows participants to be proactive about their memory loss and also offers a social and support system. Currently, these are being held through our Join Us Live events, and they're virtual.
Denisse, are all the programs virtual now, or are you also offering in-person programs?
So we have both. At the start of the pandemic, our educational programs and support groups were virtual or telephonic. Now we are slowly transitioning back to in-person programs. However, some of our programs will remain virtual.
Makeba, how does someone access the services or programs of the Alzheimer's Association?
Well, families, professionals, and the public can access our programs through our 24/7 helpline, Patricia. And that number is 1-800-272-3900. And if you're interested in joining a support group or you're interested in participating in one of our live programs, you can call that number and they will connect you to those programs. If you're interested in viewing our on-demand programs, you can visit our allsprogramsanytime.org website, and you can find a number of programs that we have recorded.
And we will have that phone number and that website for you at the end of the video. Denisse, does someone have to have a diagnosis of Alzheimer's disease to access the services and programs through the Alzheimer's Association?
No, Patricia. Individuals and those in the public are welcome to attend to any of our educational programs. If they have questions about dementia, they are welcome to call the helpline, the 24/7 helpline.
Now, many people have concerns about forgetting, and they're worried that it may be something more. Makeba, how does someone tell that the forgetting is normal, or if it's something that they need to seek help about?
Yes, that's an excellent question. And I would say if they're noticing new changes in their cognition, for example, if they're finding themselves not being able to recall certain words, or if their forgetfulness is interfering with their daily living, then it could be an issue. But there is such a thing as normal forgetting, for example, misplacing your keys or your phone, but the ability to retrace your steps and find them is normal. So I would suggest if someone is experiencing these changes and they're concerned, they definitely should see their doctor. And many people really don't realize that if they are on Medicare, that is a part of their well check, their yearly exam, that they can talk to their doctor and say, I've been noticing some changes in my memory. And would you please, let's do a short memory check to see if there is an issue.
That's good advice. There's currently a great deal of research going on about Alzheimer's disease and other forms of dementia. Is it important to have participants in those clinical trials, Denisse?
Yes, it is important. The participation is greatly needed, and it's important to have people with the disease and people without the disease as part of the clinical trials. This allows researchers to compare their genes and monitor the changes and progression of the disease.
Is diversity important in clinical trials?
Yes, it is important, the participation of different groups. Research have shown that African Americans are 2 times at a higher risk to develop the disease, and Hispanics are 1.5 at risk to develop the disease. So yes, we need the participation of these communities.
How does someone find out about clinical trials?
Sure, they can look it up online, and they can go to alc.org/trialmash, or they can simply call the helpline.
It is so important to have people participate in those trials. Makeba, what advice would you give to someone who has been diagnosed with dementia?
Yeah, Patricia, first I would say create a care plan. That's very important. It's important to plan ahead for your future and involve your family if at all possible. That way they'll know what your healthcare wishes are and your financial plans as you progress through the disease. Second, stay connected to your community. Join a support group. There are excellent ways of hearing from people who are on the same journey as you. Join our early stage social engagement programs. We have excellent programs for newly diagnosed individuals who like to create art and art appreciation. They can get connected to these programs by contacting our 24/7 helpline.
Denisse, what would you say to someone who is a caregiver for someone with dementia?
Yes, the first step I would say to seek for help. Maybe you feel like you're alone in this, but you're not. The Alzheimer's Association is available 24 hours a day, 7 days a week. That's great. Please say the number. The number again is 800-1-800-272-3900. Stay connected. Look to family, friends, co-workers, church members. If they offer help, take it. The second advice would be that we are available to provide care consultations in order to help you answer questions regarding care planning. And finally, I would say that join a support group. Attend to one of our many live educational programs. If you are short of time, then check it out on our website. ALCprogramsanytime.org. You will find them anytime there.
Such great advice. Makeba, Denisse, thank you both for being here today.
Thank you.
Thank you, Patricia, for the opportunity.
Reach out, stay connected, get help, educate yourself about the progression of the disease. The Alzheimer's Association has a wealth of resources and information for you. I'm Patricia Henderson, and this is your Weekly Connection.